Welcome, everyone. Today we're diving into acute coronary syndrome, or ACS, which is a critical condition where the heart suddenly doesn't get enough blood and oxygen.
Yep. So basically, it can result in chest pain or even lead to a heart attack, right?
Exactly. It's like a signal flare that something's really wrong with the heart, whether it's the narrowing of the arteries due to plaque buildup or even a sudden spasm or tear.
When you mention plaque buildup, you're referring to atherosclerosis, which essentially narrows those vital coronary arteries, correct?
Yup, that's the major culprit. The fatty deposits, cholesterol, and all that build up and block blood flow. And sometimes these plaques break off, causing clots that lead to a heart attack or even stroke.
Yeah. Aside from that, what other causes are we looking at here?
Well, apart from atherosclerosis, there can be coronary spasms where the muscles tighten unexpectedly, spontaneous coronary artery dissection, very low blood pressure, abnormal heart rhythms, and even situations where drugs like cocaine play a role.
Right? And what about the risk factors? I know age and lifestyle play a part, is that right?
Exactly. Risk factors are pretty broad. Age increases the risk, and being male, overweight, or having a personal or family history of heart issues ups the chances. Plus, conditions like high cholesterol, hypertension, diabetes, and certain medications can contribute.
It sounds like our lifestyles and genetics both have a big influence on whether someone might develop this syndrome.
Definitely. And lifestyle choices like smoking, not staying active, excessive alcohol use can really tip the scales.
What are some of the signs we should be on high alert for when it comes to ACS symptoms?
Common signs include that classic chest pain, which might feel like crushing, squeezing, or tightness, but it doesn't stop there. Pain can radiate to the arms, neck, jaw, or even back. Nausea, shortness of breath, cold sweats, and dizziness can also signal trouble. And sometimes there's even no pain at all, which, well, is scary.
Exactly. And diagnosing it involves a range of tests, correct? I've heard about ECGs and CT scans.
Yep, that's right. Medical professionals use an electrocardiogram to check the heart's electrical activity, along with CT scans, coronary angiograms, and echocardiograms to image the heart, along with blood tests for cardiac markers.
What about treatment options? How do they manage this emergency when it happens?
Well, treatment is multifaceted. It often includes medications like antiplatelets, nitroglycerin to open up the vessels, and even pain management. In addition, procedures like coronary angioplasty with stent placement or bypass surgery are used to restore blood flow. Plus, a structured cardiac rehabilitation program is essential
Right.
post-incident.
I have to ask though, what about lifestyle changes? Are those really effective as a preventive measure?
Great question. Yes, lifestyle modifications are critical. It's like, you need to treat your body as a temple. Healthier diets, whole grains, fruits, veggies, and lean proteins, along with reducing salt intake, exercising, and avoiding tobacco can really improve outcomes.
But isn't it sometimes a challenge with patient adherence? Not everyone sticks to those guidelines, right?
Absolutely. That's a solid point. While the medical interventions are effective, the success heavily depends on patients following through with lifestyle changes. It's a tough nut to crack, and sometimes additional support and counseling are crucial for lasting
Exactly.
change.
It seems like a comprehensive approach is needed, from emergency treatments to long-term care strategies.
For sure. Ultimately, acute coronary syndrome is a full-on medical emergency where immediate care saves lives, and long-term management, including regular consultations with your healthcare provider, is vital to reduce risk factors and prevent recurrence.
Thanks for breaking that down. It's definitely a lot to absorb, but incredibly important for everyone to know.
Indeed, staying informed, listening to your body, and not hesitating to get help when needed can make all the difference.